Hello, Dr. Kent Holtorf here with the Holtorf Medical Group. Today I want to talk about how to find a thyroid doctor. And the problem is patients go from doctor to doctor saying they're fatigued, they're depressed, they can't lose weight, and the doctor does a TSH test and says your thyroid's fine. And the problem is studies are showing that those tests can completely miss low thyroid 80% of the time. So you need to find a doctor that looks at more extensive testing, such as a lab called the reverse T3, which goes up actually when you're stressed or after you're dieting. The body will try to lower the thyroid level in the tissue, because that's what matters, what's in the tissue, in the cells, not what's in the blood. And so you want to do what's called a reverse T3 test. And if that's even on the high side of normal, very likely you're low thyroid. And it's interesting, when we go to medical school, we're taught over and over, treat the patient, don't treat the blood test. What do doctors do when they get out? Look at the blood test. That's it. So you could have textbook symptom of low thyroid. If your TSH is normal, the doctor says you're fine. It's your fault. It's a character flaw. Stop eating so much and exercise more. But 9 times out of 10, the thyroid is not optimal. And by optimizing the thyroid, you can then get those benefits, increase your energy, sense of well-being, and start actually having a chance to lose weight. So find a doctor that actually looks deeper rather than the standard blood test, and will actually listen to your symptoms. And also we have actually a test in the office that looks at tissue levels of thyroid. The British Medical Journal showed that a knowledgeable doctor looking at someone's ankle reflex was a better test than blood tests. How could that be? It correlated with symptoms better than a blood test. It was found that a normal reflex goes ch-ch-ch, but the lower the thyroid in the tissue, the slower the relaxation phase. So the company measured it via the computer, and in minutes we can determine your thyroid level in the tissue before we even do a blood test. And so that's the thing, we want to look better ways to assess your thyroid function rather than just the age-old TSH test and then blame you if it doesn't correlate with your symptoms. You don't have to live with your continual symptoms and poor quality of life. You deserve better. There is hope.